Hi, good morning. I want you to subscribe to the channel and distribute the knowledge. I'm going to do videos about how to prevent Alzheimer and dementia. First of all is vitamin D. Vitamin D is very important because it's enter the nucleus of every cell in the body and it affects 900 genes. 900 genes. So it affects your genes and how the cell work. So it is very important. So if you measure your vitamin D, look to the unit in which it is measured. For example, if your result is 30 nanogram per mil, nano ng / mil, 1 mil, 30. But he suggests the good optimal level between 50 and 80. Of course, once you go higher, for example, toward 80, it is much better. So suppose you are 30 and you want to make it 80 nanogram per mil. You subtract 30 from 80, it is 50, the difference. Multiply 50 by 100, it will be 5,000 international unit IU of vitamin D3 you take every day. But there is very important point. If you go out in the sunlight between 10 a.m. and 2 p.m., and you get natural vitamin D, it is much important because it is activated by the photon of the sunlight on the cholesterol in the skin, which produce inactive vitamin D. It go to the liver, make it activated. Then it will go to the kidneys to be activated more, then it go in the blood. So there is a lot of work on vitamin D when it is happening natural. And the scientists think there are many types of vitamin D3. It's not only one, like the supplement which you take. And also vitamin D, it should be, when you take it, it should be active and it should be absorbable and bio, meaning the body can recognize it, not synthetic. Synthetic vitamin, it's not good. And I will mention the names of the vitamin. Number 2, to prevent dementia and Alzheimer, how many hours we should fast? Only water fasting. He suggests everybody should have the foundation of a 12-hour fasting and the 3 hours no food before going to bed. So he put the 12 /3. 12 means the hours of fasting, and 3 is the hours you should go to bed, no food, so that there is no spike of a blood sugar and insulin, which is the tragic. The blood sugar, and people don't know. Because sugar is poison. The body cannot tolerate sugar. And you don't need to take sugar because the liver will make it from protein and fat. And it is toxic. Whether you believe it or not, it is up to you. So those people who have family history of dementia, Alzheimer, or they have in the family also diabetes type 2, high blood pressure, obesity, metabolic syndrome. Also those people who, even in their 40s, when they start to lose concentration, they forget. They feel the brain is foggy. They feel as if they are lost. Sometimes if they are driving, they will lose their way for a few milliseconds. They don't know where they are. They are lost. Or if you go to the room to get something and you forget, why did you come to the room? What is the item you want to take? Or you lose your keys. So don't take it lightly. So start to fast. He suggests this book between 14 and 16 hours. And I would suggest 16 hours is better. Train yourself. It is much better for autophagy and to clear the cells from the bad proteins and the rubbish inside the cell. It's just like a house. You need to clean it. You cannot live without cleaning. So the cell, it collects rubbish and bad proteins and bad mitochondria, old mitochondria. So if we fast, the cell will clear all this and renew itself, recycle itself. This is very, very important. This is from a book which is How to End Alzheimer by Dr. Dale, D-A-L-E. Bredesen, Bredesen. I am going to make it a series and mention what is the item you could do to prevent dementia and Alzheimer, and also to use it for patients with Alzheimer, or to slow it, to prevent it, and sometimes to stop it. It is not only Alzheimer, and all forms of dementia and a neurodegenerative disease like Parkinsonism. There should be a stop for these miserable diseases and the suffering we have. Please subscribe to the channel and share it with other people so that we share the knowledge and get healthy. Thank you and goodbye.